So we now turn to experts in the medical field for more guidance when it comes to masks. We're now joined by Dr. Samuel Fink. He's an internal medicine doctor at Providence Tarzana Medical Center. And doctor, thank you so much for joining us.
Well, thanks for having me this afternoon.
Yeah, for sure. So the first question is, can you give us an update on what you're seeing in your patients at the moment? Are you personally seeing an uptick in infections?
Yes, my patients are calling either they've got COVID, they're exposed to COVID. I get calls from family, I get friends. Pretty much for the last 7 days, it's pretty much most of what I've done every day is answer questions about COVID. So there's a lot of COVID out there right now. Most of it is Omicron, as far as I can tell.
And, another question is, have you noticed a difference between infections that you're seeing now versus what we saw maybe, a few months ago?
Yes, these infections are really not as severe. I'm seeing anywhere from mild cold, maybe mild flu-like symptoms. I've sent none of these patients to the hospital. And generally with Omicron, you're not going to see the loss of a taste and smell, but it can occur, not as much as with Delta. So we're seeing much more COVID, but it is milder. We know from South African studies that Omicron is probably about 70% less severe than Delta and the original Alpha strain.
Yeah, that's good to hear. And, talking about breakthrough infections, a lot of people are talking about this. So, a lot of people say maybe that means the vaccines aren't really working. What's your take on a breakthrough infection?
I just think these are great vaccines, particularly your vaccine boosted. What do I know about Omicron? It means you're not going to have a severe illness. You're not going to go to the hospital. You're not going to die. Vaccines are so important here. They can't prevent all infection, but when you do get infected, you're going to have much less severe illness. And I think right now that Omicron is going to represent the greatest threat to those that are not vaccinated and those who have not yet received their booster.
Yeah, and there's still a lot of talks about masking. In terms of masking, what are you advising for your patients to do, especially since we're seeing this surge in the new Omicron variant?
Well, certainly. I'm definitely advising masking. For my own use, I use KN95 and N95 masks. Those are paper masks, as the last part of your show indicated. I like using thicker masks to form a better seal. So for me, when I'm with patients, always an N95 mask. It's a mask that looks like this. And if I run into maybe the store for a few seconds, I'll use a KN95. But I generally don't use the paper mask because I find when I put it on my face, at least, it doesn't make a very good seal.
And when it comes to COVID, I know we all wish we had a magic ball for what the future holds. But as for you, doctor, what is your prediction of what we could potentially see with COVID-19 over just, let's say, the next several weeks?
Sure. And I think we can look at other countries, we can look at other states, see what's going to happen. You're going to see a very large increase in cases, larger than we've seen in Los Angeles before. It's called the I spike, where the cases go straight up. But the good news is that those cases are not going to be as severe as we saw with Delta or Alpha. The problem is that you're going to have so many cases that even if it's 70% less significant or less severe, you may still have an impact on healthcare symptoms, such as on healthcare systems, such as the need for hospitalization or evaluation. So that's why it's so important for all of us to get vaccinated and to get boosted so that we limit the impact on our healthcare systems.
All right. Well, Dr. Fink, thank you so much for your advice, and thank you so much for joining us today. Be safe, and we'll speak with you soon.
Thanks so much for having me. Much appreciated.
All right. Take care.